Hi, good morning, Sharon. My name is Mihiraa. Let's start the warm-up session. Do you think nurses should attend continuous nursing education?
Yes, I do. The continuous nursing education program helps nurses to update themselves with the current practices in their profession. Moreover, nowadays, it is mandatory to have specific hours of continuing nursing education to renew the nursing registration. Hence, continuous nursing education is very important for nurses.
What is your career goal after reaching your dream destination?
Right now, I do not have any clear management goals. I am very interested in learning about management and leadership and would be interested in any committees that I could participate in and learn. I have lots of ideas and would love to be in a brainstorming group, and I am very interested in the management dynamics of the organization. I feel that I need to join leadership groups to learn and meet new people.
Describe your typical working day.
My day starts with prayer. After completing my daily routines, I reach my workstation by 7:30. Before taking the handover, I complete my inventories and update the crash cart medication and dressing trolley. After receiving the handover, I interact with my patients to identify their health needs. Based on my assessment plan, a nursing care plan, and provide quality care for my patients. Afterward, I assist the physician in his work and carry out necessary clinical orders. Meanwhile, I find some time to interact with my colleagues and maintain a good rapport with them. My duty ends by 3:30 after I give a handover to the next scheduled staff members.
What are the pieces of advice for the upcoming nurses?
As a nurse, I can give a bunch of advice to upcoming nurses. Firstly, I advise them to love their profession. If anyone loves their profession, they can carry out their responsibilities in an efficient manner without complaints. Apart from that, I advise them to be dedicated to their profession and maintain professional standards. These are essential because a nurse should abide by nursing ethics on any grounds. These are a few pieces of advice that I would like to give to future nurses.
What are the qualities that a nurse should possess?
Of course, a nurse should possess a variety of qualities. First of all, she should possess excellent communication skills, which help them not only to gather clinical data, but also to maintain an effective relationship with other team members. Secondly, problem-solving and critical thinking skills are essential for nurses to deal with emergencies and difficult situations. Other qualities such as punctuality, dedication, honesty, and competency are also pivotal for nurses.
Your preparation time is over. You can now start your role play.
Good morning. My name is Sharon, and I'll be your nurse for this visit. Could you please tell me your name for the record?
Thank you. My name is Mihiraa.
Hello, Mihiraa. First, I'd like to confirm the reason for your visit today. And to see how you're feeling about the healing process and the removal of your drains. Is that what you were expecting today?
Sure, I am here for my routine post-operative check following the mastectomy 10 days ago.
Thank you for the confirmation, Mihiraa. The main goals for us today are to check how your incision is healing and, most importantly, to remove those surgical drains. Well, I can see you look a little bit anxious. Is there anything specific on your mind before we begin the assessment?
Yes, that's right. I'm a bit nervous about the drains coming out. I've been so careful with them, and I'm worried it will hurt. Also, I'm not sure if everything is healing the way it should be.
I completely understand why you would feel nervous, Mihiraa. You've been so careful with the drains, and the thought of having them removed can feel worrying. Let me explain what to expect so you feel more prepared. When I remove the drains, you will likely feel some mild discomfort, perhaps a pulling or a strange sensation, but it is usually very quick, often lasting only a few seconds, and many women tell me the relief afterward is immediate because the drains are no longer in place. After the removal, it is important to care for the small sites where the drains were. You will need to keep the area clean and dry, and I will show you how to gently clean it. You should also monitor for any leakage. A small amount of clear fluid can be normal, but if you notice persistent oozing or any unpleasant smell, you should let us know. For pain management, Mihiraa, my advice is to take your prescribed analgesics as directed, especially if you feel any soreness after the removal. Do not skip doses if you are having discomfort, because staying on top of the pain helps you rest and heal better. If you ever experience severe pain that does not settle with your medication, that is something you must report to us straight away.
The pain has been manageable with the tablets they gave me, but I still feel a tightness, especially around my armpit. I haven't seen any discharge, but my arm feels a bit heavy and stiff.
Thank you for telling me that, Mihiraa. It sounds like you've been managing the pain well with your tablets, and I'm glad to hear there hasn't been any discharge. That tightness and heaviness you're feeling, especially around your armpit, is very common after this surgery, and it brings me to an important part of your recovery. Gentle arm exercises are essential because they help prevent the stiffness you're starting to feel, and they improve circulation, which actually helps reduce that heavy sensation and promotes healing. I would like you to start with very gentle movements, such as slowly raising your arm to the front or side, only to the point where you feel a mild stretch, never to the point of sharp pain. Moving your arm regularly will help restore mobility and prevent long-term stiffness. For your lifestyle during recovery, it is important to avoid heavy lifting, nothing heavier than a small bag for now, and to gradually return to your usual activities as your strength improves. Eating a balanced diet with good protein and staying hydrated will also support your body's healing. Now, Mihiraa, I would also like to ask how you have been feeling emotionally through all of this. Many women have concerns about body image after a mastectomy, or they experience anxiety about recovery, and I want to know what support you have at home and how you are coping emotionally.
I try to do what I'm told, but I'm scared to move my arm too much in case I pull something. At home, my daughter helps me with cooking and cleaning, so I don't have to do much. But emotionally, it's been difficult. I haven't really looked at myself properly since the surgery. Every time I think about it, I feel like crying. I don't know how I'm going to feel comfortable in my own body again. My family is supportive, but they don't really understand what I'm going through inside.
Mihiraa, I want you to know that everything you're feeling is completely valid and, in fact, very normal for what you've been through. Healing from a mastectomy is not just about the wound closing. It takes time for your body and your emotions to recover together. Many women experience exactly what you're describing, feeling afraid to move, feeling sad when they look at themselves, and feeling that even with a supportive family, there is a part of this journey that feels lonely. Please know that you are not alone in this, and support is available to help you through every step. When it comes to body image concerns, there are solutions that many women find helpful when they are ready. You can speak with your doctor about breast prostheses, which are soft forms that fit inside your bra and can help you feel more balanced in your clothing. For some women, reconstruction surgery is an option to discuss later, either soon or after more healing has taken place. There is no rush to decide, and the choice is entirely yours. Additionally, there are support groups where women who have had mastectomies meet and share their experiences. Sometimes, talking to someone who has walked the same path can be more comforting than anything else. I can connect you with our breast care nurse counselor, who specializes in supporting women through these exact concerns. You don't have to navigate this part of recovery alone, Mihiraa. We are here for you, whenever you feel ready to take that step.
Thank you, Sharon. That means a lot to me. I think I would like to speak with the breast care nurse counselor when I feel a bit stronger. It helps to know there are options and that I don't have to decide everything right now. I feel a little more at ease knowing support is there when I'm ready.
I'm so glad to hear that, Mihiraa, and I will make sure the counselor reaches out to you soon so you can connect when you feel comfortable. Now, before we finish today, I need to share with you some important information about when to seek urgent medical help. While your recovery is going well, it is essential that you know the signs that require immediate attention. Please contact us or go to the nearest emergency department right away if you develop a high fever. If you notice any signs of infection, such as increased redness, swelling, or warmth around your wound or drain sites, or if you see any discharge that is thick, yellow, or has an unpleasant smell. You should also seek urgent help if you experience severe pain that your prescribed pain medication does not relieve, or if you have any difficulty breathing or sudden chest pain. Your safety is our priority, and we would always rather you call and check than wait. Mihiraa, for your next follow-up visit, I would like to schedule you to come back in 3 weeks. At that appointment, your surgeon will discuss your pathology results with you in detail, and we will assess how your healing has progressed further. How does that timing sound to you?
3 weeks sounds good. I feel much better knowing what to watch for and that I can call if something doesn't feel right. Thank you for explaining everything so clearly, Sharon. You've made me feel much calmer than when I walked in today.
You are most welcome, Mihiraa. I'm so glad to hear you're feeling calmer. That is exactly what I hoped for today.